So I think this is the exact topic, like Liz said, that people who have come to know me over the last 3 years would expect me to talk about. So sarcasm, empathy, and emergency medicine. I wanted to talk about this topic because it's important to both us and our patients. And maybe I just love sarcasm a little bit too much. But either way, at the heart of this topic lies the patient-physician relationship. This relationship is why a lot of us become physicians, is the classic answer to medical school admission committees. I want to help people, or at least that's what you tell them. But also, this relationship is what enables us to take good care of our patients and connect with them. It keeps us well, and it helps us be humble and understand the complexities of medicine. The relationship is extremely unique between us and patients. They are letting a complete stranger into some of their most personal spaces. We are invasive and overbearing. We are taking histories, we're examining them, we're getting vitals, we're treating them all behind a curtain. They do this because they need our help, and we cannot take for granted the sacrifice patients make to let us into their space. How do you, if my notes are off the bottom, how does that happen? I have a friend. I'm gonna take those real quick. I had a feeling. Sorry. Of course. Okay, sorry about that. So they do this all because they need our help. We cannot take for granted the sacrifice patients make to let us into their space. We must show that we're listening, that we care, and that we are there to help. But as we all know, this relationship has been strained. This is a trend that's being seen in medicine, has been identified, and we need to take care to understand why this is happening so that we can bring about change. But what are the reasons that we're having this strained relationship with our patients? There's at least 3 main reasons, and it's mostly coming from our end. The first one is documentation, the increased electronic medical record. God bless her scribe, or else it would be way worse. Next are metrics, or moving the department. So moving the department limits our ability to spend time with our patients, unless you're Corey. And lastly, patient satisfaction scores. And this makes our field feel like a service industry instead of practicing good evidence-based medicine. But these reasons are why in today's medical arena, we need to focus on the patient-physician relationship even more so that we can instill some change. And everyone's asking, well, why do you care about this? You're too jaded to care about this. You might not be wrong. I'm a little jaded for this. But the reason I care about this, this is my dad. His name's Al. He got diagnosed with some chronic medical conditions when we were in high school. It was during when I was in high school. This was at a tough time in his life. My parents were splitting up. He had no health insurance, and he is uneducated, especially medically. He actually didn't finish high school. And so because he had no health insurance, he always had to go to the county hospital near us. He would go wait in their ER waiting room for 13+ hours. And after waiting for that long, he would always be frustrated and angry. I never understood why that was, because I thought they wanted to help him. But after waiting that long and being treated like a county patient, I can only imagine how degrading and confusing that experience must have been for him. And I had no idea how to help him. I knew I wanted to go to medical school and be an ER doctor to help people through this healthcare system because of his experience. But the only way to help people and connect with them is through this patient-physician relationship. It all starts with empathy. This is the patient's worst day. Today they feel they're having an emergency, and it's our job to help them understand what is happening. Most of our patients are looking for help. EM isn't only about emergencies, but it's 100% about perceived emergencies. If the patient knew it was an emergency, they wouldn't need us or even come to the ER. We are the place that patients go to when they do not know what's happening, and we're there to help them with their emergency or to help them navigate this ridiculous medical system we have now. So what is empathy and why does it matter? Dirksen and friends in 2013, they defined it the best in their article that I could find. And they said that empathy is the competence of a physician to understand the patient's situation, perspective, and feelings, to communicate that understanding and check its accuracy, and to act on that understanding in a helpful therapeutic way. But why does that matter? Several studies have looked at it. there's too many to quote all in one page. The first one is the most complicated. This little table here, we're just not going to go through. I'm just going to summarize it briefly. In an article, they constructed this complicated model showing potential benefits of empathy. In short, if a physician uses empathy, patients open up to them more, they're more satisfied with their encounter, they're more compliant with treatment plans, and their anxiety about the process is decreased. This has been, like I said, confirmed in several studies. I actually linked, I just referenced them in my slides as well. In the top left corner is another article in 2018. It showed there was a positive correlation between ER physicians' reported empathy and the patient satisfaction scores they got after the visit. So that's why empathy is important. And lastly, in this one at the bottom, in 2019, interesting trend in self-reported scores for empathy in physicians and their burnout rates. And they looked specifically at ER physicians. They looked at both attendings and residents, and essentially they found over the course of EM residency training, empathy declines and improves after graduation. So hold out there, guys. Overall high burnout occurs among EM residents and improves after graduation. So keep hanging in there, guys. There was a non-statistically significant trend that showing that lower self-reported empathy scores correlated with higher burnout rates, but the power was too limited in that study. So now that we know why empathy is important, how can I show better empathy? So it can be shown in several ways. Most importantly is listening, and not just listening, but genuinely listening. I think Nikki had touched on it earlier as well. Patients and family want to know that you're listening in the moment. Both nonverbal and verbal cues can help show this, and have been studied in several studies. Body posture, eye contact can improve empathy. Drawing on their body language to agree with their feeling. So like a patient coming in pain, you say, you look uncomfortable, what can I help you with? At least you're acknowledging that they are in discomfort. Don't act rushed, even if you are in front of the patient. Don't glance at your watch, clock, or interrupt them. It is very important to sit when talking with the patient or come at eye level. Always introduce yourself when you walk in the room. It's also very important to introduce the scribe or a medical student you have with you, because the patient will not know who they are if you don't tell them. Let's see. And then always ask everyone in the room to introduce themselves as well, so that every patient family member in the room. And then always thank them for waiting. Dustin has a nice little trick. He's always told me to say, thank you so much for your patience rather than apologizing for the wait. So you're kind of telling them that you understand that they have been waiting and that you're thankful that they were. But how does humor or sarcasm have a role in empathy in this relationship? Obviously, this is my favorite part. This is my coping mechanism. As much of a surprise as it was to Mike, I really am quiet until I get to know you. Sarcasm is my defense mechanism, especially during uncomfortable situations. In public speaking events like this, this usually occurs outside of the patient-physician relationship, at least the gallows humor, but where does sarcasm and humor play into the patient-physician relationship? In an article in 2004, Berger and friends looked at types of humor directly in the physician-patient encounter. Gallows humor is seen as destructive because it distances you from the situation and can lead to emotional numbness. This is directly contradictory to the previous tenet of empathy, where you want to connect with the patient. On the other hand, therapeutic humor is inclusive and doesn't separate you. It can be used to connect the patient with the physician. It can also be considered a therapeutic modality on its own, and also help solidify this relationship so that you can enhance the effects of more traditional treatment therapeutic modalities. However, the role of humor in the physician-patient relationship is far more complex and nuanced than the question of whether humor itself is therapy. There is a wealth of knowledge, as we discussed earlier, that empathy is important for this relationship, and the authors of this article stated that the judicious use of humor is a useful technique that can facilitate communication, promote bonding, and enhance patient satisfaction. But of course, are there negatives to humor? In an article in 2006, it was titled, "If We Don't Use Humor, We Cry." There was a survey handed to nurses, and it was regarding their use of humor about patient interactions and how they used it to cope. The nurses who used humor more frequently had decreased burnout rates and had higher emotional expressivity. And then in another article, in 2003, there was numerous authors that have written about the value of humor to healthcare professionals. Humor helps doctors and nurses deal with the stress of caring for patients who are in pain. It also fosters good working relationships among colleagues and improves morale. And having a positive attitude at work can extend to colleagues and support staff. And healthcare workers who greet colleagues with a smile usually get one in return. And lastly, in an article in the Annals in 1989, they examined some strategies that ER physicians use specifically to manage stress and prevent burnout. Some of the mechanisms they used that were most effective were drawing on past experiences, ignoring the stressful event by becoming involved in another activity, or seeing humor in the situation. And the doctors with the best coping skills of those three also reported the highest level of job satisfaction and sense of personal accomplishment. So I guess, how does empathy and sarcasm and humor, how's that played into my residency? So I've always tried to incorporate empathy into my practice. I've always tried to sit or crouch next to the gurney, well, at least until coronavirus ruined that. And I always make eye contact and synthesize what I've heard and talk it back with them, summarize what I've heard with them. And then I get a patient who looks like the picture above, who doesn't want to be in the ER. And I try to incorporate some sarcasm, humor, and empathy by saying, what annoys you besides me? And it usually gets a chuckle out of them. And they realize that I have expressed that I know that they're annoyed. And then we can start the interaction so we can get them out or wherever. If there's ever is an interruption, which that never happens in the ER, I always tell them where I'm going. Usually it's a radio call, where Linda, and the overhead for us. So patients don't really notice it. And I say, hey, the ambulances are calling. I'm gonna go get that call. I'll be right back. And then when I come back, I say, I'm so sorry about that interruption. I heard this, and this about your presentation. Does that sound about right? Okay, and then what else do we need to still talk about? Is what I try to always do. And then whenever I leave a patient encounter at the end, I always say, can I get you anything else right now? And it's usually a blanket or water. And then if I can, I do that. And then and then I also end it with anything we didn't talk about that you think is important. I think that really helps include the patient in their interaction. What about sarcasm and humor in my residency? So I think I told some of the people at graduation this story, but this really hit home with me recently. That really solidified this for me in my residency. So I was at Loma Linda on the surge pod. They bedded a patient in Surge 3 who was here for facial swelling, and he was screen positive because he was homeless, and his chief complaint was facial swelling. So I went to go see him. I walk in and he cannot stay awake. Like, wake him up. He wakes up briefly and goes back to sleep. Sir, do you use meth? Nothing. Wake him up. Sir, when did you last use meth? Goes back to sleep. Start to rub him. Wakes up. Starts yelling at me. I go, sir, how much meth do you use? And when's the last time you used it? And he goes, doc, why are you all cut up on this meth thing? Are you going to ask me about my tooth pain? And I'm like, wow, okay. So he taught me that we can use sarcasm in the patient-physician relationship. And it actually connected us. So we actually had some more jokes, talked for a while. And at the end of it, he said, you're the only doctor that's talked to me this long before. I was like, oh, okay. This really hit me and realized how burnt out I was, because that's all I was worried about was his meth use. And he was really worried about his tooth pain. And so this really put things into perspective for me. And this was an example of sarcasm and humor that could be used to kind of connect patient and physician. And so to summarize kind of the points that I've made so far is that the patient-physician relationship is at the core of what we do. It is the most important thing we do. Empathy, you need to show empathy, it's required. It's very easy to incorporate those things that we're talking about. Sarcasm and humor affect the relationship between the patient and you, as well as your ability to handle burnout. And do what I say, not as I do. So I have a little too much gallows humor when I talk to patients as well. But you can always take into your relationships with patients the easy empathy tenets. It's easy to sit, pay attention, maintain eye contact, and connect with your patients, and then it'll get better. So hey, all the studies show that empathy gets better after residency, so it'll be okay. One last parting thing is, I really like this quote: "What you do matters, but why you do it matters so much more." and then some prayers for our next adventure, mostly for my child having to put up with me.